welcome to Docplexus News, healthcare headlines that matter. Government of Himachal Pradesh has suspended 7 doctors. This move was taken to teach a lesson to the absconding doctors in the state. Health and Family Planning Minister Mr. Kaul Singh, during his interaction with the media, stated, "These doctors were not properly performing their duties and attending the patients. Besides, they were involved in private practice, violating government services rules." The Medical Council of India has sent notices to the hospitals that have employed MBBS graduates with an illegal master's course in emergency medicine. Dr. Srinath, the president of the Society of Emergency Medicine, which offers such courses, claimed that they do not give any PG degrees. Following the success of first womb transplant surgery in Pune's Galaxy Hospital, 21 women have registered for the transplant. Docplexus team had an exclusive interaction with Dr. Puntampekar, Director of Galaxy Hospital. Dr. Puntampekar commented,
"Since last 4 weeks, we have had about 122 inquiries from all around the country as well as from all around the world. In fact, people from Europe as well as the African countries are coming up, and we ourselves are very surprised that so many women did not have their uteruses and were keeping a very low profile and were not able to face the society because there was no hope." I think this is a big ray of hope for these unfortunate women who now would have a little chance of experiencing not only motherhood but a child of their own and could lead a normal married life.
In a 2009 case, State Commission has held Delhi Hospital guilty of negligence. The hospital pharmacist had performed the surgery, leaving a needle inside the woman's uterus. The State Commission dismissed the hospital's appeal and imposed punitive damage of 30 lakhs on the hospital. Researchers at Duke University have designed a new polymer injection which has a precise controlled release mechanism with optimum circulation in the body. The technology has the potential to replace daily dose insulin with once-a-month injection. The World Health Organization has published and ranked the Antibiotic List in a bid to counter the growing drug resistance. The updated list has 30 medicines for adults and 25 for children. Assistant Director General Dr. Mary quoted, "Safe and effective medicines are basic essentials and should be accessible to population and is vital to countries' progress towards universal health coverage." According to recent media report, the Organization of Pharmaceutical Producers of India endeavors to develop and expand an integrated disease management process broadly engaging with affected communities in the fight against non-communicable diseases. The Government of India policy think tank Niti Aayog has tweeted that about 16 states made a presentation to Niti for development support to transform their health sector. Out of 16, 3 states will be supported. As per an ICMR study, the prevalence rate of diabetes estimated in 15 states of India is 7.3%. Dr. R.M. Anjana, lead author and Vice President of Madras Diabetes Research Foundation, stated that although diabetes is considered as a rich man's disease, prevalence of the disease has been reported in poor population in richer states. Drug Controller General of India has relaxed guidelines for production of pediatric HIV drugs and approved child-friendly pellet formulation of lopinavir-ritonavir without feasibility studies. General has recommended that the National AIDS Control Program conduct post-marketing surveillance of the first 100 patients. In the era of digitization, mobile health devices are steadily becoming an emerging method of increasing patient engagement. Docplexus recommends its medical community to take benefit of remote monitoring tools and various healthcare apps as a means of early intervention and excellent follow-up care for increased patient engagement and ultimately better healthcare outcomes. These were the latest happenings in medical field brought to you by Docplexus, India's largest and fastest growing online community of doctors. Stay tuned for more. Happy Docplexus!